Let's join hands and celebrate our blood donors and save lives. You never know whose life you may save. Thank you.
My name is Dr. Donar. I'm the Planning Information and Research Manager for National Blood Service Zimbabwe, also in charge of the blood donor program. And it's my pleasure really to be addressing the various blood donors in Zimbabwe and globally for their continued support in terms of making sure that patients' lives are saved through the blood donation that they give. In Zimbabwe, we're quite blessed that we do have 100% blood donation program that is based on voluntary non-remunerative blood donation, which is really supported by WHO. And since 2005 in Zimbabwe, we have been actually commemorating the World Blood Donor Day, which falls on the 14th of June. And this year is no different from those years as we continue to celebrate our blood donors. But this year it's quite unique because of COVID-19. We had to have these virtual celebrations. So it's our first time, but we thought I think we will not have the donors miss this opportunity really to be celebrated for the good work that they are doing. So just to give a little bit of information in terms of the blood donor program here in Zimbabwe, we do have 5 centers in Harare, Bulawayo, Gweru, Mtare, and Masvingo, and we do collect blood within the radius of 200 to 300 kilometers, and 70% of our collections are really from the school children, and we thank them. And the adults are also increasingly making donations to the blood program, and we are quite thankful to that. We do have the blood donor committees in 5 branches, which they really contribute and make sure that we have got sufficient blood donors in these respective provinces. I know one of the key questions that might be asked, especially from the donors and also from the public, is to say, how can we be able to maintain the blood program, especially given the current COVID-19? As National Blood Service, we're prepared for this kind of scenario in trying to make sure that we do have access to our panels, and we thank our community leaders for giving us access to those. And also the various health authorities really for making sure that blood program is actually regarded as essential service. So we are really permitted to operate nationally during even also this trying time. So we have been doing the business quite well, and we've been collecting quite well with the support of even also the law enforcement, allowing our donors to pass through. And as the National Blood Service, we have also strengthened how we communicate with our donors. We have strengthened our contact center, which has got now facilities that allows them to even communicate with the donors on WhatsApp, and we are also setting up a donor mobile application so that donors can easily get in touch with the National Blood Service. But we have also made sure arrangements to make sure that the donors, when they come to donate, they come, as scheduled. Just try to make sure that we manage the issues to do with the social distancing as required. So all our donation facilities are well managed and making sure that we are quite compliant, and we have been doing quite well in that particular regard. So if there's anything that at least we can do to make sure that your safety is guaranteed, so the donors should not be afraid to come out and donate, because our staff has been trained well in terms of making sure that there are no possible infections that can actually happen within our donation facilities. Social distance is being observed, and sanitization is also being enforced. The mask will also be provided for the staff, even also for the donors. So even as we celebrate this World Blood Donor Day virtually, we know maybe in the future we have more opportunity to interact, but we also view the fact that I think it has also allowed us even also to, as blood donors, to give an opportunity really to be able to virtually interact. And we do hope that, especially the adults, it's always very difficult to get adults together for them to be able to socialize because of the different pressures of life. But this virtual celebration that I think we've done will be maintained going forward to make sure that we do have the adults that will come on board and make sure that they're able to interact through these particular virtual programs. So having said that, I just want to thank the blood donors, because without them, we will not have this particular blood program. And as you also notice, we have got a blood donor award program for those donors who have actually reached different milestones, like 150, 775, and the different milestones that we do. So we encourage the donors to continue donating blood as much as possible. But we also believe that it's also important to recognize the various institutions that allows us to get into their premises, destabilize their programs, just for the purpose of allowing blood donation program to go on. Since 2006, we've been actually celebrating or honoring the schools with the highest blood donations through our schools blood donation program, which I think has been going on quite well. So we are maintaining that. We will be giving certificates and also the other prizes that we are also partnering with the corporates that would also have come on board. Further to that, we have also, starting this year, we will be also looking at honoring our universities and tertiary institutions for them in contributing to the blood donor program. So again, a program has been put just trying to make sure that we honor these particular blood donors, and we welcome partners, we welcome the corporates to really partner us in this particular noble cause so that we honor our various institutions that really make contribution to the blood program. I know the blood program could not be successful without the contribution of our partners. Some, they sponsor the bleeds that we do have, they provide refreshments, they provide a lot of different accessories that we need, even also for honoring our blood donors. So again, we encourage them to continue with that particular program. And as a result, our blood program will remain viable, and it's our desire as National Blood Service that whoever requires blood will be able really to get blood and make sure that the patient's life is actually saved. So I will encourage the blood donors to continue to make sure that even in 2020, we will also record histories, making sure that no lives has been actually lost simply because of the predicament of COVID-19. But we have managed to come together and make sure that the blood is always available. So please, let's join hands together in celebrating World Blood Donor Day 2020. Thank you. Thank you. It's my pleasure to welcome you to the
14 June is World Blood Donor Day. Let's join hands in thanking our blood donor. Save blood, saves lives. Happy World Blood Donor Day!
I donated blood, and it is such an amazing experience, actually making a difference in someone's life, because I already know that 1 pint can save 3 lives, 1, 2, 3 lives. So today I want to challenge someone to also donate blood. If you know someone who wants to donate blood, please share this on your social media so that we have more people coming in, because we know that just because there's COVID, you'll need your blood, you know. So just come on guys, let's just do this, share it, create a video at home with your kids, with family, and you know, and let's do this.
National Blood Services ngizodonate igazi ngiyalikhuthaza muli eZimbabwe odadewethu osisi omama labo baba, because si-celebrate amachumi ayisithupha nambili for i-National Blood Services. So siyalikhuthaza ukuthi libuye ngobuningi benu sikhona ukudonate igazi, sinceda abantu abagulayo, sinceda abantu abenza ama-accidents, because kubalulekile ukuthi sibancede, sibasize ngalesi sikhathi. So siyabonga, ngiyalikhuthaza mina eZimbabwe ukuthi celani lidonate igazi ukuze sikhona ukusiza umphakathi. Siyabonga.
to you all over the world. I hope you're enjoying our first ever World Blood Donor Day virtual commemoration. COVID-19, COVID-19, COVID-19. Who would have thought that right now we would be doing things differently? But that has not stopped us from showing you how we can make the world a better place by donating your blood and saving lives. We trust that you're enjoying the virtual commemoration. We've been to different nations, in all parts of the world, to bring you different entertainment so that you can enjoy. My name is Esther Masunda. I'm the Public Affairs Manager, spokesperson for the National Blood Service Zimbabwe. Very soon and shortly, we're going to be crossing over to Kaguvi Building, where we're going to receive some remarks from the Honorable Minister of Health and Child Care, Dr. Obadiah Moyo. We heard from the President himself as he saluted the blood donors, thanking them for the immense contribution that they give to saving the lives of the President of the Republic of Zimbabwe, Comrade Emmerson Mnangagwa, on Monday the 15th of June, delivered a presidential statement to all blood donors in Zimbabwe to show that you are special and you'll continuously be special. So let's sit back and hear what the Honorable Minister of Health and Child Care has to say from Kaguvi. Currently a blood donation day taking place right now. So please, when you're done watching, please come over to the National Blood Service Zimbabwe, 53 Mazoe Street. Or you can also go to Joiner City or any of the blood donation centers across the country. Make your donation. Save blood, saves lives. That's it for now.
morning, Zimbabwe. My name is Dr. Christopher Pasi. I am a specialist physician and clinical director for Salim Mugabe Central Hospital, formerly known as Harare Hospital. We commemorate the World Blood Donor Day this year under the cloud of COVID-19, a pandemic that has affected the whole world and requires us to exercise social physical distancing, which in effect entails the reduction in terms of movement of people from one place to another. This comes in the context of us requiring a very important resource in our healthcare system. And this resource is the provision of safe blood. Our donors are an integral stakeholder in the provision of this important component in our healthcare delivery system. The provision of safe blood is an effort that is realized through the efforts of our National Blood Service and our important stakeholder, who is the blood donor. This kind of integration of all these components of healthcare system enables our patient to then be able to get a resource that means life. There is that motto that goes by the saying that blood is life. And indeed, blood is life for our healthcare system. Safe blood enables us to get a number of components from the blood system, which is the blood cells themselves that we transfuse in our patients, that we also are able to get other components such as platelets, plasma, and cryoprecipitate. All these components are required in the day-to-day function of the healthcare system. We use blood in a number of circumstances within the healthcare system, both pre-surgical, post-surgical, in times of trauma, in times of patients who have got sepsis and infections where we require to improve their oxygenation, in terms of patients with other chronic diseases where their own bodies are unable to make this a resource for themselves. It is therefore critical to know that with blood donors who come in to provide this service, we are always able to then give safe care to our patients. The Zimbabwe government has put blood as a central component in the healthcare delivery system and has therefore enabled us as healthcare workers and systems be able to give blood for free within our healthcare system. This is a part of the effort to make sure that blood, which is quite an expensive resource, is accessible to all our patients. We therefore always cherish the love and the commitment of blood donors who, within this very difficult time of COVID-19, continue to come and donate so that we can continue to give a very important resource to our patients. For example, we notice that our hospital per week, which is a very high turnaround and consumption of blood and blood products, it is therefore obvious that without that kind of resource, we are unable to provide the critical care that we need for our patients. I thank you.
Right, I'm back again at the National Blood Service Zimbabwe. Our team has crossed over to the Ministry of Health and Child Care. So the minister's just getting ready because he was attending to other very, very urgent issues. So we'll use this opportunity to allow you to go for a short drink or a coffee. And then when we resume back our broadcast, we'll then be live at Kagui Building to join the remarks of the Honorable Minister of Health and Child Care. For now, we are breaking our broadcast and then we will resume and then we'll be at Kagui Building. Take care for now. Shaita.